Question: a person who can't speak but can listen and understand, how you will find out his needs. Answer: when caring for a person who cannot speak but can listen and understand, it's essential to use alternative methods of communication to understand their needs effectively. I will observe the person's nonverbal cues and body language for signs of discomfort, pain, or distress. I will pay attention to facial expressions, gestures, and changes in behavior that may indicate their needs or preferences. I will use simple yes/no questions that can be answered with gestures or head nods to gather basic information about the person's needs. For example, I could ask, "Are you in pain?" and observe their response. I can use visual aids such as picture cards, communication boards, or written instructions to help the person express their needs and communicate with me. I will encourage them to point to or indicate specific items or symbols to convey their preferences. I will consult with the person's family members or caregivers who may be familiar with their communication patterns, preferences, and needs. They can provide valuable insights and assistance in understanding the person's needs and communicating effectively with them. I will stay patient and supportive while communicating with the person, allowing them sufficient time to process information and respond. I will use a calm and reassuring tone of voice and provide encouragement and positive reinforcement for their efforts to communicate. I can explore alternative communication methods such as writing, drawing, or using gestures or facial expressions to convey information and engage in meaningful interactions with the person. I will regularly check in with the person to assess their comfort, well-being, and satisfaction with care. Encourage them to communicate their needs and preferences and be responsive to any changes or concerns they may express. By using all these strategies and being attentive to the person's nonverbal cues and communication preferences, I can effectively understand and address the needs of individuals who are unable to speak but can listen and understand. It's essential to approach each person with empathy, respect, and sensitivity to ensure that their communication needs are met and that they receive high-quality, person-centered care.